Hello everyone, today we are going to talk about deep vein thrombosis or clots in our legs. Deep vein thrombosis or DVT is actually more common than most of us think. A lot of people who go on flights or people who are not able to walk around either because of illness or because of surgery end up getting these clots stuck in their legs, in their arms, in their lungs, or in any other parts of their body. The commonest site of a deep vein thrombosis or a DVT is the leg. It will come with an enlarged leg, which is warm to touch, very painful, and sometimes reddened. It's just one leg. It's not like both of the legs are enlarged. If both legs are enlarged, then it's most likely from another cause. But if one leg is enlarged, then you have to think that it could be from a clot. What are some of the things that will put people at risk for having clots in their legs? Having long flights, being immobile because of maybe a surgery, maybe they have done a surgery at the hip or the knee, maybe cancer or a waist problem and the person cannot move around. Long distance journeys like traveling from Accra to, let's say, Wa, or maybe from Wa to Lagos. Very, very long distances. And the distance will differ from person to person for you to trigger it. If you are someone who travels long distances regularly, you have to think about ways of reducing your risk of getting this disease. Other risk factors that we have noticed is having varicose veins, being obese, being heavy, obese, using contraceptive pills. With contraceptive pills, the risk comes the longer you use the contraceptive pills. For example, if you have to use it for years. What should you do if your leg is getting big and you're not sure what it is? The first thing I would say to do is to go and see your medical doctor. If your doctor is suspecting a clot as well, he will quickly let you do a Doppler ultrasound of your leg. After you do the scan will pick if there is a clot or not. If there is a clot, your doctor will go ahead and give you medication to dissolve this clot. Now, there are two main types of this medication. There is one where you inject directly into the skin, and then there's another where you take through the mouth. Especially in individuals who are pregnant, you'll be given just the medication that you inject through the skin. But for those of us who are not pregnant, your doctor will most likely either start with the medications which you inject through the skin, and then afterwards follow up with medications which you take through your mouth. Depending on the cause of the clot, your doctor may treat you on this medication for 3 months or even up to 6 months. In a few cases, however, your doctor may decide that you need to be on the medication for a long time, being several years. In all of these situations, it is advisable to talk to your doctor and find out exactly why he is giving you the medication for that number of months or years. If it remains untreated, the clot can break off in the leg and travel all the way to the lungs. They can block the lungs and prevent blood from receiving oxygen. I believe we all know that oxygen is gotten to the blood through the lungs. If the oxygen is no longer getting to the blood, the body is no longer receiving the oxygen, and this can sometimes cause death. In fact, in up to 50% of people who get this condition, in fact, one of every 3 people who get clots in their lungs end up losing their lives. That's a whole 33%. So, if you are suspecting that yourself or your neighbor or your friend may have a deep vein thrombosis or a clot in the leg, I will advise that we see the medical doctor. We make sure that it is not a clot. If it's a clot, we treat it rather than wait for the clot to get to the lungs and cause a lot of problems. When the clot gets to the lungs, doctors call it pulmonary embolism. How do we prevent deep vein thrombosis? Number one, let's stay mobile. Try and walk around, try and be active. Even if you've done a surgery and the doctor has cleared you, as much as possible, try and move up and down little by little. If you are on a flight, try and walk around a bit, especially if it's a long flight. If you are going on a long journey, for example, from Accra to Wa, try and encourage the driver as much as possible to take breaks. I know that from Accra to Wa, for example, Metro Mass takes some breaks at certain places to allow people to stretch out and all that. Apart from allowing you to eat, it also allows you to prevent clots from being formed. Take advantage of these breaks, walk around, stretch out your legs, and let blood circulate through your veins and arteries. If for some reason you feel that it is not possible to prevent yourself from being immobile, maybe because of a surgery and then you cannot walk around, you cannot move around, or it's a very long flight, or maybe you know that the trip you are going to, there's no way that you'll be able to move around, you can speak to your medical doctor. In a few cases, we give medications to prevent clots from forming. Talk to your doctor, and if this is a possibility, he will give you medications to prevent a clot from forming. Thank you very much. I hope you learned something from this discussion. This is the Ghanaian doctor.